Good morning, everyone, and welcome to the International Interprofessional Mentorship Program. I am Dr. Kate Barlow, the founder and today's host for the meeting. It's June 2nd, 2022, and today David Thomforde is going to talk to us about horticulture therapy. Please mute yourselves during the presentation. However, you can unmute yourself whenever you'd like to ask a question, or you can type your question into the chat box and I will answer it for you. In order to receive a certificate of attendance for today's meeting, please complete the survey link in the chat box that I will post in just a second. And then you'll need to remain on the webinar until the presenter is finished. At the conclusion of the presentation, we will have an optional meet and greet. Thank you all for coming today. And David, thank you so much for this presentation.
You're welcome, Dr. Kate. Thank you for inviting me here. I've been not as involved lately as I had in the past, but I've been enjoying being involved in this and doing some research on this topic. And I'll be talking about horticultural therapy. It's not my area of expertise, but it's an area I'm greatly interested in. So the definition, in order to do horticultural therapy, it involves engagement of a person in gardening, plant-based activities, a trained therapist to achieve specific therapeutic treatment goals. In this regard, it holds that in common with other types of therapy. We always have a therapist present. We always work on specific therapeutic treatment goals. In the United States, we carry it out in rehab centers, long-term care facilities, psychiatric facilities, community settings, and other different places. The essential elements are, number one, involves growing plants. And this can be seeds, it can be trees, it can be crops, it can be ornamental plants, but involves some aspect of growing plants. Like any other therapy, OT or PT, it involves specific goals. We need to be working on specific things for a patient. And there does need to be constant presence of a therapist or therapy assistant. This can be an OT. There are specific certified horticultural therapists in the US, or other rehabilitation professionals such as PTs can also do this kind of therapy. And it can be either a group or an individual treatment. There are some activities that are related, but not quite the same as horticultural therapy. For instance, therapeutic horticulture, it sounds exactly the same, but it does not involve individual goals. It's people getting together to engage in gardening for therapeutic purposes, but no specific individual goals. Social gardening is another related activity, and this is more people getting together to garden together, for their own benefit, but again, no specific goals, no presence of a therapist. And then adaptive gardening is when we try and make gardens more accessible to people with physical, psychological, cognitive needs or other impairments. Now, OTs can carry out therapeutic horticultural therapy, but OTs can also be involved in these related activities. OTs can set up social gardening groups in rehabilitation centers. They can facilitate groups getting together to do therapeutic horticulture, or they can plan adaptive gardens in their facilities. There are lots of benefits, and some of them have been proven by research. Others are more common sense. Stress relief. But working in a garden can be relaxing. The smells, the sweet smells, the sights, beautiful sights, the relaxing sounds, and also in a garden, a lot of things that people do are rote. You don't require a lot of concentration, so it's easy to relax in that situation to reduce stress. Therapeutic horticultural therapy can increase people's sense of empowerment. People can develop self-confidence, learn new skills, and these skills can directly improve their well-being. There can be different kinds of social stimulation. There are all sorts of ways to provide visual, auditory, gustatory, olfactory, tactile stimulation during a activity in a garden, which can improve sensory integration. And like any aspect of occupational therapy, we can grade the level of stimulation so it's appropriate for the person involved. There can be physical improvement. Gardening, digging can work on strength. It can work on range of motion. Reaching down to plant on the soil can work on your standing or sitting balance or your hand-eye coordination. Planting small seeds can work on hand-eye coordination. Pruning plants can work on hand-eye coordination. Just in general, the gardening activity can work on your endurance. And as with all these things, we can grade them. So we have a different level of challenge for different people. There can be all sorts of activities in gardening that will involve cognitive improvement. People can memorize things like gardening plans for improving their memory. They can work on problem solving, trying to figure out what the best plants are to plant in a different place. Planning these activities, memorizing plant needs, scheduling, following directions. There are all sorts of aspects that we can work on cognitive improvement. Social skills training. Gardening does not have to be a social activity, but it can be. And when a group of people work together to plant, to harvest, to dig up ground, it does involve cooperation, involves communication. You need awareness of the needs of others to plant a group garden together. And this can also stimulate increased communication. People need to be able to communicate as they're planting, as they're doing things together, and it can bring up memories that can stimulate conversation. So there have been lots of studies done of benefits of horticultural therapy. I have just cherry-picked, so to speak, some different studies that have been done. For instance, Gonzalez et al. Worked with depressed patients and found that the gardening activity decreased depression and decreased rumination. It decreased the tendency of people to stress on things that happened in the past and made them think more positively of the future. Occupational Zaitra studied community gardening and found that it improved resilience and reduced isolation, increased social connectivity in patients. Detweiler and Warf worked with stroke patients, post-stroke patients, and they found that the gardening environment was less threatening, more motivating in an indoor clinic. Rather than doing paperwork activities to improve fine motor coordination, they were using, planting seeds rather than doing, strengthening exercises in the clinic. They were working with a shovel, and these were more motivating than working in indoor. Turner et al. Studied bone density in older women and found out that the weight-bearing activities involved in gardening increased bone density. And then Lee, et cetera, compared patients who attended an 18-week therapeutic horticultural therapy program and found improvement in upper limb function and balance. So all these are examples of research that's been done that has showed benefit from horticultural therapy. The history. Ever since human beings have settled down, when we were nomads wandering around, we didn't have the option of gardening because we didn't know where we were going to be in the next growing season. But when we decided to settle down and establish towns and cities, then we began to garden, we began to grow plants, and the focus is on growing plants for food to eat, but we've also grown plants for pleasure, just to look at. Gardening has been part of our history for many thousands of years. The first documentation, as far as I know, was by Dr. Benjamin Rush, who was one of the founders of therapy of all sorts in the United States. And this was as long ago as almost 200 years ago. He documented the benefit of working with plants for psychiatric patients. And then, as many of you know, in the United States after World War II, there were a lot of soldiers who had been wounded and who were returning from the war, who had survived because of antibiotics. And there was a lot of therapeutic techniques being invented, and gardening was one of them, using rehabilitation techniques with wounded soldiers. And it began to go from psychiatric patients to people with physical disabilities. So in the 1940s, it expanded greatly, this therapeutic gardening. And back as far as 1932, specifically occupational therapists have documented the benefits of eating gardening. In 1997, horticultural therapy became a separate profession in the U.S. In order to get this professional degree, you need to take a bachelor's degree program and have 500 hours of internship. But OTs do not need this degree to use horticulture as a therapeutic tool. We can use it as one of our toolkit in working with patients. There are lots of considerations when you're planning a successful horticultural therapy program. Therapeutic horticultural therapy, the different aspects, the different programs are so diverse that you can't say this is how it's done. All you can say is here are things to think about, and then the therapist involved can take these different considerations and plan a program. So, for instance, it'll all depend, of course, on your patient population. Whether they have psychiatric or physical needs. It will depend on the environment. It will depend where you're living. It will depend on the type of weather. But in general, we need to think about some different things. It's good to choose plants that are native to the area because these will have greater resistance to disease and you'll have a more successful program. It's good to choose plants that are locally valued. This means that if somebody learns to grow these plants during therapy, that after they have finished their therapy, they can use these skills because people will want their products. And then related to that is choosing plants whose items to sell. So these can be sold both during the program to support the program and afterwards by patients. Making gardens physically accessible is important so that people with different physical needs can access them. And then having a variety of type of plants, having some plants for food, some plants for beauty, to expand the diversity of the program. It's very nice if you can to have a variety of shapes and textures and colors of plant leaves and flowers to provide a greater cognitive experience for clients, and the great degree of complexity of physical layout. Again, that makes it a more challenging cognitive task for the planners and a more complex task for the people using the garden. But again, you need to vary this depending on the clients you're working with, what their needs are, what their level of cognition is. Excuse me. You can vary the complexity of the plant raising process. There are some plants that require very special attention, daily attention, daily watering, daily weeding. There are other plants that, to be honest, thrive on neglect. You can throw the seeds in the ground and they grow. Again, this will depend on where you live. There are some special techniques you can teach for people with more improved cognition, who want to learn skills, grafting, where you're putting a more viable plant onto a stronger rootstock, composting, using a pesticide, special fertilizers. You can think about whether you want your plants to attract or not attract animals such as rabbits, deer, or birds. If you want to attract a garden, if you want to plant a garden that will attract these creatures, it can be a more stimulating environment for the patients, but you can also lose some of your produce. So you need to think about that. Also for insects, if you have a garden that attracts bees and butterflies, it will be more cognitively stimulation. But if you have patients who might be allergic to bee stings, you want to be careful about what you plant there. Doing some research about the local temperature and rainfall so that the plants are appropriate. You don't want to plant plants that need a desert environment where you have a very heavy rainfall. It's good to choose a site that's accessible to a patient population, so people can get there easily. You need to think about how you're going to prepare your soil. Is it soil that will require a tractor, require a shovel, strong helpers? You need to think about that when you're planning where your garden will be and what you will plant. And then if your plant, if the plants require water in addition to rain, you need to make sure you have access to water. There's no sense in planting water lilies if you're in the middle of a desert. Thinking about the local soil, there's a lot of research here. It's not just for the patients, it's also for the therapists to do a lot of work and background studies. Find plants that are appropriate for local soil, and then think about the amount of sun in your spot. Or if your spot is already selected, then you need to think about what plants that will do well in that spot. You can think about whether your garden will need a fence. If you are planting food crops and you have lots of animals around that would enjoy eating the food, then you need to think whether you need a fence. Likewise, depending on where your garden is and who lives around you, you need a fence to protect from neighbors so that you don't lose your crops. And then you need to think about what funding you have to work with. Whether you have funding to pay for people to come to help with the garden, whether you need machinery, things like that. Related to the sun is also whether you need shade. If you have patients who for some reason have problems with overheating, then you need to think of a plot that has trees or a structure providing trees, or whether you need to plant trees or build a structure. And then thinking again about what plants, how often they need care, whether they're ones that can survive without watering, or whether they're things that need regular attention. So now let's talk about making a physically accessible garden. These are our ideal parameters. It depends on your patient population, depends on who you're working with, it depends on your available resources. Not all gardens can live up to these parameters. Not all gardens should, because these are parameters for ideal situation. But depending on what you have, depending on where you live, depending on what resources you had, you can adapt them for your patient population. So one possibility is making raised beds. And there's a picture further here. This is the kind of beds we're talking about. The ones on the left are made out of bricks. The ones on the right are made out of wood. The one on the right is made out of wood. So these are troughs of wood up on legs, so patients don't have to lean over. And they should have a minimum amount of soil in them. And that is both so there's space for the roots to grow, and also so that the ground doesn't dry out too much. If you have too little ground, it will dry out quickly and the plants will have trouble surviving. If you can, they should be made of rot-resistant wood or bricks or something that will not degrade so fast. You can also line them as plastic to keep the wood from rotting. If you're making raised beds and you want them to have access to both sides, they can be up to 5 feet wide. That means that people can reach in from both sides. But if people can access them only from one side, they should be no more than 2.5 feet wide. Again, these are some pictures of the different kinds of raised beds you can make, but these are pretty fancy ones. I've seen ones made with old timbers, with logs that can be much just as effective, but less fancy. The height of the beds, that will depend on your patient population. Of course, if you have children, you need shorter beds. If you have people who need to sit, then there's a certain height they should be for access when sitting. If you have patients who need to stand but can't reach the ground, then you have a certain height, 30 centimeters. Excuse me, let me start again. 30 inches, that they should be that tall. And then if you have a diverse population, You'll need raised beds of different heights. Some beds at ground level, some beds at maybe at 18 inches, some at 24 inches, so that people of different populations can work at the different types of beds. If you have wheelchair users, then the most important thing is that how high the base of the bed should be, because you want to make sure that the patient can get their knees under the wheelchair, under the raised bed, and get close to the bed. You can put seats next to raised beds or tables so that people can sit down while they're working. And then, excuse me, if you do have a problem making a big bed, you can just make a table and have different pots on the table. And this will have more versatility. You can plant different things in different pots, but they'll also dry out more quickly. Excuse me, but I didn't bring enough water. I need to get a little bit more water to drink.
Totally fine. Thank you, everyone, for coming. I'm going to put in the chat for the last time the attendance link for today, and also I'm going to put in the chat the survey link for the research study that I'm currently doing with a couple of colleagues from Bulgaria, someone from Romania, and my friend Saeed from Morocco. We're looking at pediatric education on a global scale. This is really a needs assessment study to look at the different levels of pediatric education globally, and at the end of the survey it asks what you would be most interested in receiving for pediatric education, because hopefully then we will be doing pediatric competencies for free for therapists in countries that don't have the same level of pediatric education as those of us in the United States, where it's an entry-level master's degree. Thanks, David. I was just chatting.
Good to take advantage, Kate. Again, these are some, on the left-hand side, an example of a raised bed that's wheelchair accessible. On the right side, just using different kinds of pots to plant equivalent situation. You can also use hanging baskets for people who can't bend over. They do allow efficient use of vertical space. You can have baskets of different heights. People can also make something called a terrarium, which is a large glass jar with a lid, or in an aquarium, that contain a small ecosystem of plants. That would be more for just for enjoyment rather than growing a crop of some sort. And here are some pictures on the left-hand side, a terrarium, where somebody's made, put mosses and different kinds of things like that just to create a small ecosystem. And then these are examples of hanging pots. You can see how they can be planted at different levels on this fence, or different lengths of string, just to create a very space efficient area of garden. Paths. People need to have access to your raised beds. So ideally you'd have a hard surface such as cement or macadam, but if you don't have those available, you can use gravel, bricks, stepping stones, wooden planks, beaten earth. The important thing is to make sure that if you have a patient that has a tendency to trip, that you have paths that are smooth enough so people won't hurt themselves. Like with anything else, when we're talking about wheelchair use, we need to make sure there's room for wheelchairs to pass. So if you have one-way traffic, you can have a path of 5 feet wide. Whereas if you want two-way traffic, you want to have 8 feet wide. Ideally, your paths should be closer to the beds and no more than 8% grade on the paths. There are some different tools that people can use. You can adapt your tools, trowels for digging, shovels for more serious digging, rakes to clean up debris. And again, depending on the patient grip strength, upper extremity strength, upper extremity range of motion. You can have tools that have longer or short handles. If somebody has poor range of motion, you would want to have a longer handled tool. You can have tools with handles at right angles to the blade that can provide more efficient digging. Larger handles for people who have trouble gripping, and maybe even a wrist cuff to support the wrist during use of the tool. There are some websites that you can go to in the United States. These are two of them listed where you can get some of these therapeutic tools. But I know that in many situations, people don't have the funds to buy specific tools. So it's very useful to go to these sites to get some ideas and think of things you can make yourself. So for instance, if you need long handled tools, you can attach pieces of wood or PVC pipes to local tools. If you have a tool that you want to use, but it has the wrong kind of handle, you can bend the handle to provide a 90-degree angle there. You can wrap the handles of local tools to rubber strips so they're enlarged. Here's some other ideas. Let's see if we can look at this for a minute. Okay, this is a site. I'm afraid it's not. It doesn't have. I was hoping there are some pictures here. Let's see. Question is how I get back again. This is always the problem. Okay, let's see. This may have some pictures. Yeah, here we go.
So David, we're still seeing your PowerPoint. I think you would have to stop sharing and then reshare your screen so that we could see what you're seeing.
Okay, let me try that. You see them now, Kate?
Yes.
Okay, so some different kinds of long handle tools here. Again, ones you can purchase or ones you could make by attaching a tool to a handle to a local tool. Some of these here on down the left have easy grip handles. Here's one that has a wrist cuff that you could attach to a tool. A fork with a angled handle that makes it easier to grasp onto. Again, various ideas that you can use to adapt things you have to local conditions. Okay, I guess I need to unshare and reshare that. I'm learning, Kate. Let's see, I think we're here. Yeah, okay. And again, thinking of watering cans, so, if you need to provide water, if you have a bigger watering can, it will be more physically difficult. If you have a plastic watering can, it'll be easier. Again, it will depend on your patient population. You also want to think about what plants to use. Some of these are sort of duplications of ideas from before, but sort of grouped to be same ideas altogether. Again, when you choose what plants you're going to use, you need to think of the season you're going to be planting, what the weather is like, how much garden space you have, and what the patient impairments have. We've already talked about using plants of a variety of colors, textures, and smells for sensory experience. Deciding if there are plants that patients will want to eat or use for other purposes. Decide if you want to attract butterflies. Now let's talk about specific patient populations. So if you're working with patients with visual impairment, it would be nice to have plants with bright contrasting colors and plants with strong smells. If you have people who are completely visually impaired, then a rope along posts or guide edges will help people go from place to place in your garden. If you can plant things that have interesting textures or making noise, these will present sensory stimulation to people with visual impairment. And if you can put in a stream or a fountain, that will make a noise, a relaxing noise. Or hanging strips of paper, they'll rustle in the wind. That can provide auditory stimulation in a garden. For physical impairment, we've already discussed these, but raised beds will help people and pots on tables for people with wheelchairs. If you have people with psychosocial impairment, one thing to think about is whether you need to have a sense of enclosure. If you plant trees or shrubs around the edge, that will provide a sense of enclosure. If you have patients with anxious. And again, your streams and sounds can create a peaceful background noise, and plants with sweet smells promote calm and relaxation. If you have people with intellectual impairment, then often it's good to use large plants. They'll have more trouble dealing with small plants, both from a point of view of fine motor coordination. It's probably with this population, it would be good to plant seedlings or mature plants. They'll have more trouble dealing with seeds, and they'll take a longer time to present a result. So a person with intellectual impairment would get more gratification from planting seeds or mature plants. You do need to think of plants that can be harmful if eaten. Again, this will depend completely on where you live. In the United States, we have some different kinds of flowers that can be poisonous if the leaves are eaten. There are also a couple of crops. There's a plant called rhubarb that if you cook the stems, they're delicious, but if you eat them raw, they can be poisonous. So you need to think about your population, whether they're going to eat the plants by mistake. There's something called a memory garden that can help patients with dementia. You can select different plants that have importance for people from their past, either past gardening or cooking experiences. And planting these plants will stimulate memories and stimulate conversations for people. Excuse me. Thus far, we've talked about basically the planting and harvesting process, but there are various other ways in which patients can be involved in therapy sessions. So for instance, these would be more for some of the higher cognitive level and more physically capable patients, but they can work with local landowners on finding appropriate plots of land or negotiating for their use. You could have a group, a therapy group that determines where you want to plant. And working with the landowner. The whole process of digging and fertilization can be a therapeutic process. Digging for those who are physically strong, fertilization, planning what fertilizers to use, how much to use, when to use it. That will be a great activity for a therapy group. If you're making a compost container, as I'm sure you all know, compost is taking the plant residues, the stems, the leaves, things like that, putting them in a container and letting them decay to create new garden soil. So if you're making a compost so you can plant more plants later on, you need to think about what goes in the container, when you need to water it, when you need to mix it, where you're going to use your finished compost, and you can have a specific container, or you can dig a pit and put your compost in a pit. And then you need to think about if there's a strategy for selling the results of your garden, if there are any results. And this is more on the same thing, but selling the seeds, the fruits, the vegetables, other products of the garden. You can have a committee that sells them, that sets up a little shop and sells things. You can have a group that works on the maintenance of the raised beds, making sure they don't rot, the tools, making sure the tools are kept in good shape. The tools are kept clean and don't get damaged and stored properly. Thinking how you're going to store your tools and supplies, and then having schedules so that things like watering, weeding, and harvesting are done on a regular basis. And then thinking about your fencing needs, if any. So here are some examples of some fairly fancy accessible gardens. Gardens therapy gardens don't need to be this fancy. They can be just one single raised bed. And here are some pictures of people enjoying raised beds. The children in the middle and on the left at a bed that's appropriate height for them. On the right, somebody working on the ground, but they have in a wheelchair, but they do have a long-handled fork, a long-handled hoe they can use to garden with. Here's some different references, the references I cited in my study, and then some other resources you can go to. So I barreled through this a mile a minute. I hope it wasn't too fast. I do have a tendency to talk fast when I'm presenting, and I apologize if it was too fast. But I guess I also have a dry throat today, so that may be part of the reason for going fast, just to get it done with.
Yeah, this is wonderful, David. Thank you so much. And for those of you, I had put out a request for topics that people wanted covered, and horticulture was one of the topics. I couldn't find anyone to present on. So thank you, David, so much for doing the research to really present on this, because this was a requested topic. Does anyone have any questions for David?
Or do any of you have experiences that you would like to share of making a accessible garden, doing therapeutic horticulture?
I will share. I did when I used to work in a skilled nursing facility with the elderly. We did some gardening, and the patients really wanted to take home what they made. And so I started, in addition to the sort of raised beds that we had, we started doing like individuals in these like little containers so that they could take home. So in addition to working on the facility garden, they could also have their own that they could then take home with them. So if you have the ability to do that, I know with children, sometimes we'll do styrofoam cups, like little disposable cups that are really inexpensive. But the adults really wanted to take what they had made with them. All right, well, I'm going to end the recording, and if you have any questions, you can always email me or David later, and we will do our best to answer your questions. Thank you so much.